Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, complications of subarachnoid hemorrhage. So in the complications, there can re-rupture of subarachnoid hemorrhage can occur in the first month. That is, in 30% of the cases, re-rupture of subarachnoid hemorrhage occurs in the first month, and this re-rupture may peak in the first 7 days of life. Sorry, in the first 7 days after the symptoms. And this is also this re-rupture is also this re-rupture is also associated with, so this is also associated with almost 60% of mortality. It is associated with 60% of mortality, and thus it is poor outcome is seen because of re-rupture. Then there is other complication, which is hydrocephalus is also a complication of subarachnoid hemorrhage. Hydrocephalus, we have vasospasm can occur, hyponatremia is a side effect, and severe cerebral edema is a side effect. Okay, is a complication. Okay, so we will see each of them again. So first, hydrocephalus can be acute or it can be chronic. In acute, if there is acute hydrocephalus, it can result in stupor or coma, and there is one more type which is called as subacute also. If it is a subacute hydrocephalus, it develops over days or weeks, and in subacute hydrocephalus the patient will present with slowed mentation, and along with the patient will present with urinary incontinence. Okay, whereas in chronic one it develops over weeks to months, and in chronic hydrocephalus actually the patient present with gait difficulties, difficulty in following a particular gait. There can be urinary incontinence can be there, or there can also be impaired mentation is also seen in chronic hydrocephalus. Then if we see the rest of the complications, vasospasm can also occur due to the subarachnoid hemorrhage. Vasospasm is seen in around 3 to 7 days after the diagnosis, and it is delayed. It causes delayed morbidity, and death can occur in the patient due to vasospasm. Then hyponatremia can also occur. In the hyponatremia, this hyponatremia develops quickly within first sorry this hyponatremia develops within first 2 weeks after subarachnoid hemorrhage development. Here this hyponatremia can be due to the natriuresis, or it can also occur due to the volume depletion. Natriuresis and volume depletion with subarachnoid hemorrhage can result in hyponatremia, and it will also result in hypovolemia also. Hyponatremic hypovolemia will also develop. And one more important thing is, now because of this and one more thing is here, atrial natriuretic peptide and brain or B type natriuretic peptide is also released. Because of that, this can result in cerebral salt wasting syndrome. Okay, now this hyponatremia will in most of the cases it clears over 1 to 2 weeks, it clears off. Then the next complication is severe cerebral edema. Severe cerebral edema is actually, it is also a complication of subarachnoid hemorrhage. It presents in patients with infarction from vasospasm, and this cerebral edema may also increase the intracranial pressure, and this can decrease because it can increase the intracranial pressure, decreasing the cerebral perfusion pressure. Okay, now how are you going to treat this cerebral edema? This cerebral edema, you should give drugs like mannitol is given, or we can ask the person to undergo hyperventilation, and if required, even sometimes hemicraniectomy may also be required in some cases.
Thank you and thank you for watching.